So, welcome back to Drug School. I am Adam, and today we're going to talk about dispensing drugs to animals. So, with that, welcome to Drug School.
Welcome back to Drug School, and this is Adam, your host. Tonight's presentation, well, it's tonight because I'm recording it in the evening, but this presentation is entirely as a result of my friend Mitch, who runs the podcast Retail Pharmacy. If you haven't seen it, check it out. I'll put a link in the video description below so that you can check out his podcast. It is, well, for those of you who work in retail, it is like my weekly retail therapy, and I do appreciate Mitch's efforts in making sure that we all feel like we are not an island in this profession, and we truly aren't. So, Mitch, if you happen to watch this episode of Drug School, I really hope you find it very insightful. It is co-authored. This was a presentation that my friend Tom and I gave back when I was working in community pharmacy, and we presented this to our state association's annual convention. So this was a continuing education program that we had done a couple years ago on treating the veterinary patient in the community pharmacy. And it's a very poignant topic as we see veterinary prescriptions show up more and more in the retail world, especially with the $4 lists, the free antibiotics. Dogs can take cephalexin, and if you have one of those pharmacies that gives away cephalexin for free, you may be dispensing some of that cephalexin to dogs. So this presentation is entirely built around helping you find resources where you can dispense veterinary prescriptions safely. We'll talk a little bit about some of the regulatory concerns. I'm a regulatory specialist by training, so you'll hear me talk a little bit about that. There'll be some clinical stuff that'll be here that was written by my friend Tom, and you'll see some of his fingerprints on this as well. So like every other ACPE accredited presentation, you'll see some objectives. So we're going to identify some of the common veterinary medications that you find in community pharmacy practices. I'll give you a couple of doses. So this might be a good one where you take some notes. We'll list some of the common veterinary references. I will put links to places on Amazon where you can find the books that we're talking about. I'm going to talk a little bit about drug abuse by proxy, and that actually has a broader implication than on animals. It also happens in children as well, which is a very sad topic. I've actually seen it twice in my 11 years of pharmacy where I've actually seen parents taking their children's controlled substances. I've also seen it happen in animals where they abuse their animals to obtain controlled substances as well. And it sickens me to say that, considering what you're about to see in a couple of slides as to how I got into this. And then there's a few things that the FDA and the Public Health Code are going to tell you are responsibilities related to treating veterinary patients in the community setting. And we put this poster together. This was by my former employer, and you see that pets are part of the family, and we know how much you love your pets, and I love my pets. So when we talk about these. You see Talon in this picture, and you'll see a better picture of Talon now because that was when he was a kitten. This picture was taken several years ago. But these are my fur babies. So Jackson, who's actually at my feet as I record this right now, and then you have Rico Suave on the left there, Talon. He was harassing me a little earlier while I was doing some environmental health studies work for my master's program. Uh, they're my children, and in all reality, we want to treat our pets like children. So that's what this presentation is all dedicated for. The reason that we started seeing this is Oregon actually surveyed some veterinarians on pharmacist dispensing of pet meds. And since we are not veterinary experts as pharmacists and pharmacy technicians, unless you specifically know exactly where to get your dosing from, you may do some things that you're not supposed to do. So here's going to be a couple of cases where we got it wrong, and these are sad cases. So here's one where a dog was prescribed 15 milligrams of Finabar twice a day. Client arrived at the pharmacy to pick up the medication. The pharmacist had told her that the dosage was too high and that she should reduce it by half. We'll learn why the pharmacist was wrong in that instance in a little bit. And the subtherapeutic treatment caused the dog to continue to suffer from seizures, where the veterinarian did a recheck and discovered that the dose was wrong. They ended up deciding to euthanize the dog. Another case, a pharmacist suggested that a client purchase Rogaine to treat her dog's alopecia. Minoxidil is an active ingredient in Rogaine, and we normally would give that out to human beings for alopecia. So thinking it would work great on their dog and not having the proper toxicology information about dogs, that dog suffered from cardiomyopathy as a result, and that was something that the pharmacist did not know. That dog thankfully survived, I believe, if I remember the story correctly, but that could have been a very serious problem that could have killed that animal. And then there was a dog with an autoimmune disease that was treated with azathioprine. The retail pharmacist dispensed azithromycin. The patient relapsed and had to be euthanized. That one's actually more of a common mistake that we would have typically made because those are look-alike, sound-alike drugs. So you do have to keep an eye out for those as well in retail practice. APHA has told us that we need to understand veterinary drugs, and so has NABP. And NABP's Model Pharmacy Act and rules state that every pharmacy should have ready access to references, at least one current reference in each of the following categories: state and federal laws, pharmacology, which we all know, facts and comparisons, or micromedics, or something along those lines for our pharmacology knowledge. Dosing and toxicology, they've added veterinary drugs, and I'll give you a couple of resources on a little bit. They've also said that pharmacists should be educated in the veterinary world. So I have preached this 2 years in a row that we all need this information, and I do stand by that. So as far as veterinarians go, we for the most part see doctors of veterinary medicine. Those are DVMs, and that's a degree awarded by all but one veterinary school. If you see VMD, they are graduates of the University of Pennsylvania. They are DVMs, it's just they call it a veterinary medical doctorate instead of a doctor of veterinary medicine. So it's a slightly different acronym, but they both mean the same thing. Veterinarians can be board certified in specialties just like human doctors can. So veterinary dermatology, veterinary ophthalmology, zoological medication, and internal medicine, just to name a few. One of my best friends in the veterinary world, he's a colleague to me, or at least was until I changed practice settings. He was a colleague to me twice. His name is Dr. Ryan Colbert. He works at the zoo here in Grand Rapids. But he was also a colleague for me because we taught at the same college in Muskegon. So we both taught in the same place, and we also both worked in the same field. Um, Dr. Colburn is now the president of the West Michigan Veterinary Medical Association, WMVMA. Which I was a member of. They actually still welcome me with open arms, and I still give presentations for them from time to time, but I haven't been able to go to a meeting in some time because I'm in graduate school. Um, so, needs must. The last group that you'll usually encounter are veterinary technicians. They can either be certified, registered, or licensed. You'll see one of those three acronyms follow their name. They are just like pharmacy technicians are, except they're more like nurses, really. So if you think of a vet techs are kind of like the nurses of the um, veterinary world, but they also kind of have this pharmacy technician aspect of them because a lot of veterinarians dispense. So my experience personally and professionally is that veterinary technicians are just as good at math as pharmacy technicians are, and they are incredible, incredible professionals. And you have to understand that veterinarians are putting up with a patient who cannot verbally tell them what's going on with them. Their owners or their staff, dogs have owners, cats have staff, keep that mentality in mind. Um, they know the outward appearances and the behavioral aspects of their animals, but they don't know what goes on inside of them, and their animals cannot tell them that they're hurting or that they're sick. So you have to keep in mind that a veterinarian is usually working with a lot of nonverbal cues in order to treat a patient, but they do that very well. I might add. So, who is your patient? Veterinarians treat just about every animal. Most are small animal practitioners, which would deal with dogs, cats, ferrets, guinea pigs. Um, Slightly larger animal veterinarians deal with horses, cows, sheep, goats, llamas. What else have I treated in my life? Gorillas, tigers, lions. The gorilla was an interesting challenge, I might add. Um, so I've treated a wide variety of animals, and one of the things that you learn when you do veterinary practice is that animals are a little bit more finicky, and cats especially so. Good luck giving a cat a pill, I might add. Um, so you find yourself doing a lot of things with cats that you wouldn't normally do either in human medicine or even pediatrics. You almost have to treat cats like a really, really picky pediatric patient. So in vet speak, the patient is the animal. You'll also hear the word client, which is the owner of the animal or the pet being treated. Um, Almost everything is done in milligrams per kilogram, and veterinarians will call that meg per kg, if you ever hear that. The granddaddy of all of the abbreviations they will use, and it will throw you for a loop, is SID. If you ever hear SID in abbreviation, it means once a day. We normally in our practice would call that QD. SID in veterinary speak is semel in dia, which just means once a day. So, what are some of the animal or the medications you'll see in animals? The most common one that you'll typically see, especially in cats, is amlodipine. Cats generally tend to be a little bit on the hypertensive side, especially if they are obese, and cats tend to get obese as they get older. Um, This is one of the few drugs that is not dosed by weight, especially in cats. In cats, generally it's dosed by the cat. In a dose up to 2.5 milligrams per cat, you kind of start off at 0.625. Um, in practice, this is really hard to do with tablets. Because the 1.25 milligram Norvasc is really, really, really tiny. So splitting it in half, you almost shatter the pill. My advice is to go to the 2.5, and if you have to, quarter that. I believe some of the doses are actually scored to be quartered. So that is a good approach to that problem where the 1.25 is too small. In dogs, it's not generally used, although it might be used in adjunct to an ACE inhibitor. So you might see um, uh, typically lisinopril used in dogs, although with cats and dogs, they have really started going to angiotensin receptor blockers or ARBs, the sartan class, specifically telmisartan, which is Micardis is its brand name. Prednisone and prednisolone, and you have to be really, 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 really careful with this one, especially in cats. So just like we use in human beings, we use prednisone and prednisolone in cats and dogs for an anti-inflammatory effect. Prednisone, for the record, is poorly absorbed in horses, so we generally use that topically in horses as an anti-inflammatory drug if that's a skin condition. For dogs and cats, what you're going to typically see, dogs can have a maximum dose of 80 milligrams at 2.2 milligrams per kilogram per day. Cats, surprisingly, need double the dose, and they use typically prednisolone for this, and the reason being for that is cats do not have the enzyme to convert prednisone to prednisolone, and that can build up some toxicity. So since they can't make that conversion, it's generally preferred that you use prednisolone instead, and you use it at 4.4 milligrams per kilogram per day. So it wouldn't be terribly uncommon that my 93-pound pit bull and my 15-pound cat may actually end up with the same dose of prednisolone. So that is just something to keep in mind. Keep an eye out for diabetes, osteoporosis, congestive heart failure, hypertension, renal insufficiency, all of the same human side effects. One of the recurring themes I'm going to bring into this is you may see some similarities to human medicine, but cats and dogs are not little humans, and it's very important to remember that. Trazodone is typically used as a way of treating anxiety, and it's specifically usually used to sedate cats prior to veterinary visits or travel anxiety. Don't usually typically see it in dogs. Um, there's other dog treatments that work better in dogs for anxiety, but for cats, this is the preferred method because it's a very fixed dose. Um, and it's relatively inexpensive. So usually you will see cats that do not react well to having a veterinary visit get premedicated with trazodone as a way of relieving the stress of the vet visit itself. So trazodone dosing is kilogram based for dogs, but for cats it's very specific. It's 50 milligrams and it's given 60 to 90 minutes before travel or veterinary treatment because you need that 60 to 90 minutes for it to kick in before cats will actually react to it. In dogs, it depends on which level of kilograms you're at. And theirs isn't, since it's an anxiety thing, they're typically going to be on that chronically, and it's given every 8 to 12 hours, which is in stark contrast to how you see trazodone dosed in human beings, typically a little bit longer apart in human beings. Leavitt Ear Sedum is another common drug that you will see typically in dogs. Cats usually don't suffer from seizures, but dogs do. Now, Leavitt Ear Sedum has something unique about it in that normally you would not use an extended release treatment in dogs because their intestinal tracts are really short, and so it's um, 30 milligrams per kilogram if you're using the XR tablets, or it's 20 to 30 milligrams every 8 hours if you're using IR tablets or using the liquid form. And in cats, it's 20 to 40 milligrams per kilogram. Again, I have not typically seen um, cats have seizures. So if they're having seizures, usually it's because they're having an active infection. So their treatment on Leavitt Ear Sedum would probably be very short. Um, and it probably would just be as an adjunct to an antibiotic. Fluoxetine is very commonly prescribed, and you see it a lot in cats, especially cats that have some antisocial behavior, shall we say. Um, so the adverse effects, again, are just as they are in human beings because they are SSRIs. There actually is a dog labeled fluoxetine available on the market that you can purchase from like Henry Schein or Anda, and you would be able to give that to a dog as a chewable tablet. It's 1 to 3 milligrams once a day, and it may take 4 to 8 weeks. And it's usually titrate to effect. In cats, it's typically used for urine marking. So if your cat tends to have the effect of spraying, especially if it's a rescue cat, to kind of break them of that habit, you may actually use this for about 12 weeks, and then hopefully that behavior is corrected and you don't have to use it again. If it's a cat where they have some antisocial behaviors, like they tend to want to bite, then you typically would see this daily at a dose of 0.5 to 1.5 milligrams per kilogram. And it's not terribly uncommon. You're going to have to compound that into some type of a liquid. Theophylline. Theophylline has to be given as a bronchodilator. We don't generally like to use it because dogs and cats do not tolerate caffeine very well. And I have to move my little timer here because I covered up some dosing here. And what you'll typically see is a 100 milligram ER tablet or a capsule for cats, usually given in the evening. And it sometimes is every 24 to 48 hours. Dogs, it's every 12 to 24. And generally speaking, you'll see the ER products used on that as well, just because that's what's available. I have done theophylline in liquids in compounding land. It's not a really great drug to compound with, but if needs must, you can do that. You do have to monitor them, though, for a cardiac arrhythmia. And also, you have to watch out for the fluoroquinolones because they can increase the theophylline levels, which may increase the toxicity. Phenobarb, typically given to dogs. You might get it into cats. Typically with cats, it's going to be the quarter grain tablet, the 16.25, sometimes labeled 15 milligram tablet every 12 hours. With dogs, it's 2.5 to 3 milligrams per kilogram. So you will see much higher doses in dogs, and that's given every 12 hours in dogs and cats, by the way. So do keep that in mind. Anxiety, agitation, lethargy, sedation, all of the same side effects you typically see. You do have to watch for respiratory depression in cats. So be very careful of that. And also, cats can sometimes get hypoadrenal function, so they can go into adrenal failure with phenobarb. Levothyroxine, or the thyroid hormone. The one thing you want to watch about the levothyroxine dose is in dogs, you will see this dose is a lot larger than you see in the human being. So Synthroid, the highest tablet you can get is 300 micrograms. In dogs, that dose can go as high as 1 milligram. So typically with dogs, you might see zero point 0.8 to 1 milligram total daily dose, or 800 micrograms to 1,000 micrograms per day. Cats generally get a much lower dose, although with cats, generally they don't end up hypothyroid, they end up hyperthyroid, and we'll talk about that in a second. Um, they will only give this out as long as the cat is not diabetic. And they also use this in caution in their elderly animals. So if the dog or cat is usually above the age of 8, they use this with extreme caution. Adverse events, tachycardia, polyphagia, excitability, nervousness. And in dogs, you'll see excessive panting. Cats may appear actually apathetic, which, how would you really know that? Be very careful with desiccated thyroids, and also do not confuse this with liothyronine. Liothyronine in dogs is given every 8 to 12 hours. So if you're using T3, you have to use it more frequently than using T4. Diazepam is given to dogs and cats for the treatment of seizures, or sometimes for behavior modification. Now, the dose is a lot higher in dogs. Notice that it's 0.51 milligram to 1 milligram per kilogram. Dogs do not tolerate diazepam very well, especially orally. Typically with dogs, we do this rectally. But if you are treating a larger dog like a Great Dane, don't be shocked if you see a diazepam dose that's 100 milligrams. I about had a stroke when I had that happen to me the first time when I worked in compounding pharmacy 11 years ago. You have to be really, really sensitive to the fact that cats and dogs are not little humans. So a 10 milligram dose is not going to touch a dog. A 10 milligram dose will actually touch a cat, maybe, but because their livers don't generally tolerate this very well, you won't typically see it used. Dogs do not have a lot of enzymes to break down benzodiazepines, so as a class of drugs, they're not very well used because they just do not absorb them very, very well. If you're using it for seizures, though, the 3 doses per 24-hour rule, and doses should be about 10 minutes apart until the seizure is controlled. If the seizure is not controlled, it's time to have that animal be seen by a veterinarian. Gabapentin, let me first preface, you have to watch the inactive ingredients in gabapentin and in all medications just as much as you have to read the active ones. So gabapentin typically in the oral solution has xylitol in it. Xylitol is toxic to dogs. So do not use xylitol containing products in dogs. This is also true of the lisinopril oral that is out on the market, known as Quebrexit. The lisinopril oral solution also contains xylitol, so it should not be used in dogs either. Gabapentin is typically used to treat seizures. It also is used as an analgesic. If your state controls gabapentin, like Michigan or Kentucky, I believe Tennessee now considers it a controlled substance as well. If your state does control gabapentin, you do have to follow all of your controlled substance rules. For dogs, the dose for gabapentin is 10 to 20 milligrams per kilogram. It's given every 8 hours, and that's for seizures. That dose is halved, titrated to effect for analgesia. For cats, typically you're going to be using it to treat analgesia. So it is typically used for pain, and you start at 3 milligrams per kilogram once a day, and then you titrate up to 5 to 10 milligrams every 12 hours. This was a favorite drug of our hospice veterinarian in town, so typically we saw a lot of gabapentin dispensed for cats, especially for neuropathic pain, and especially in diabetic cats. So in dogs, never use xylitol. there is a reason for that. Dogs rapidly respond to xylitol. So it can create a response to, especially if you live in a rural environment, you may not actually have time to get to a veterinarian before your dog will die. So watch out for xylitol. It will cause a hypoglycemic effect, and it'll do it very rapidly, usually within 5 to 10 minutes. So if you do accidentally give a dog xylitol, they have a very short period of time to start treatment at the veterinarian before you run out of blood sugar to treat the dog with. Other likely toxicities in dogs. Dogs do not do NSAIDs very well, and that means you have to watch out with aspirin. Aspirin should not be given more than once a day, and it should not be given more than just as a baby aspirin is probably going to be the highest thing that you'll use. It does cause gastrointestinal ulceration, just like it does in humans. Ibuprofen, naproxen, and acetaminophen are completely contraindicated in both dogs and cats. The methylxanthine class, which is caffeine in chocolate, and theophylline have longer half-lives in dogs than they do in humans. So if they do eat it, it's likely to make them sicker faster. For cats, again, acetaminophen and NSAIDs are extremely toxic. Cats cannot demethylate diazepam very well, so that can cause some irreversible side effects. And doxycycline specifically can become lodged in a cat's esophagus and cause esophageal erosion. And if you are going to do that, you do have to follow it with 6 milliliters of a non-irritating liquid, namely water. That was always fun to explain to animal owners. The liquid form is apple raspberry flavored, which is completely unpalatable to cats, and it can often cause profuse salivation, vomiting, and resistance to administration. So you may have to come up with a different way of dosing that out. Capsules should not be used, and neither should the tablet. You do have to use a liquid with cats on doxycycline. I won't go into all of these. You can get your own resources for this, but there are some typical toxicities by species. The God book to use is Plum's Veterinary Drug Handbook. It's a 1,300-page book. It contains everything you need to know. It is available online, and it is also available in book form. I've used both. It's very easy to use. It contains all of the common dosing and most of the common drugs. You can also use the exotic animal formulary. We had to keep this on hand because we worked with the zoo very frequently. The exotic animal formulary is set up by species. So if you do treat ferrets, guinea pigs, parrots, lizards, we had a Komodo dragon as a patient once. So we needed this book to help us out with some dosing. And of course, with the zoo, we had penguins and lions and tigers and gorillas and bears and a hedgehog, I think, was a patient once. So when you start doing zoo stuff, you'll have to use the exotic animal formulary. The Handbook of Veterinary Pharmacology, this is what my college uses to teach pharmacology to veterinary technicians. It's a very handy, quick study guide, and not a bad book to read, but it is a little bit more into the chemistry of the drugs rather than it is about the dosing. So if you're looking specifically for dosing, this isn't going to be a great resource for you. But if you want to learn about the pharmacology of how animals react to drugs, this is not a bad place to go. Other places you can go, the Green Book, which is approved animal drug products. There is the Compendium of Veterinary Products. There's the Merck Veterinary Manual, which is available online. Cornell University has a School of Veterinary Medicine that they will do consults with. The FDA has a site, and so does the USDA. The FDA deals with all drugs animal, And the USDA deals specifically with drugs being used in agricultural animals, chickens, rabbits, anything that is food producing. And you'd be surprised at how broad the animal producing category is. There is a pet poison helpline. The ASPCA also has an 800 number that you can call, and there's also pet poison control. So if you have any questions or patients come in having questions about whether their animals have had issues with medications, they can consult them. VetMeds.org is the American College of Veterinary Pharmacists. That is ACVP. They have a annual convention once a year. It's usually at the end of May, early part of June, and they get into animal compounding. They get into animal medications. So if you're very interested in that particular area of practice, you're more than welcome to join them and find out a little bit more. This year's convention is actually going to feature Tom, who was co-author of this PowerPoint, and he will be down there speaking as well. I'm pins and needles to see what he's going to be talking about because I'm going to be editing his presentation as soon as he sends it to me. Then there's also the Society of Veterinary Hospital Pharmacists, SVHP. That is another place to go to check out some resources, and also has a drug shortage website as well, so you can find out more about that. The AVMA has some resources for you as well. That's the American Veterinary Medicine Association. And if you really want to get into the clinical aspects, go meet some veterinarians. They will welcome pharmacists with open arms usually. Ours did. So we approached at the time it was called the West Michigan Academy of Small Animal Practitioners. And it merged with the West Michigan Veterinary Medical Association, and they welcomed us with open arms. And I did a couple of presentations for them. I know Tom, my partner in crime in all of this, has done a couple of presentations for them. Their meetings are usually fairly interesting, especially when you go to the drug rep ones. The drug rep ones always bring some kind of doctor who's describing some disease that you've never even thought of. But I remember eating dinner one night and talking about pinworms in animals. That was disgusting, but I digress. You also have the Michigan Veterinary Medical Association. That's for me locally. That's who I would be talking to. Your state probably has a similar chapter if you're not in Michigan. And if you're listening to this from Canada, I know your Canadian counterparts have this as well. So there are a few regulatory concerns. This is going to primarily talk about U.S. law. So when we talk about U.S. law, and you'll see a couple of Michigan-specific abbreviations I'll talk about as well, you have to keep that in mind as well. That I may talk about state law. I'll do it in the context of Michigan, but the caveat there is going to be talk to your state Board of Pharmacy or your state Board of Veterinary Medicine to make sure that you're in compliance. First off is sales tax. Each state has their own rules about sales tax on prescription drugs. Some states actually do have a generic sales tax on prescription drugs. I know Illinois was one of those last holdouts in that regard. If your state does have a sales tax on prescription drugs, it may have a different one for non-human prescriptions. So you do have to double check and make sure that a different sales tax rate doesn't apply. In states where there are non-taxable human prescriptions, non-human prescriptions may be taxable. So make sure you consult with your state Department of Treasury to make sure that you are in compliance with those rules. And you may have to develop a workaround in your pharmacy system in order to make sure you charge the right sales tax amount for prescription drugs. I will talk about drug abuse by proxy for a moment. So drug abuse by proxy means that you're obtaining drugs using another person or animal. We've had 4 cases of people in Kent County in the 11 years that I practiced that trained their pets to exhibit pain to obtain buprenorphine or gabapentin or tramadol. I have seen some children getting prescription drugs for various controlled substances like benzodiazepines and ADHD medications, and having their parents taking their children's medication. So drug abuse by proxy is a problem. And it's not just related to animals, it is also related to human beings as well. A couple of facts from the regulatory view. Some veterinarians do not have DEA numbers and some do. So if it is a controlled substance prescription, make sure you check and verify that they do have the right licenses to do that. If your state does have separate controlled substance licenses, generally speaking, veterinarians are exempt from having to obtain a separate Board of Pharmacy controlled substance license, but you do keep an eye out for that. Veterinarians not only prescribe, they also dispense in most states, and that's usually about half of their revenue in their offices. So keep in mind that you have to be sensitive about the fact that you can dispense for animals. What I have found that goes a long way is becoming a partner with them instead of a competitor. And if you present yourself as a partner for their more challenging patients, they're more likely to respond to you. Also, veterinarians are not legally allowed to have MPI numbers. That's a HIPAA thing. MPI numbers exist only in HIPAA land, and since veterinarians do not send insurance claims to treat human beings, they're not allowed to have an MPI number. There's a caveat to that. The caveat in that regard is that veterinarians are allowed to have an MPI number if and only if they are also MDs and DOs. So in Michigan, in the Upper Peninsula, we do have a couple of dual certified doctors. So we have veterinarians who also see human patients. For those of you who are old enough to remember the 1980s movie Baby Boom, where the veterinarian was also the town doctor, we do have a few of those in Michigan too. So if you're in a more rural area, you may have a doctor who's also a veterinarian, and they would have an MPI number for their human practice, and that might be used as an identifier in veterinary practice as well. But if they were just treating animals alone, they are not allowed to have an MPI number on their own. Prescription requirements are mostly the same as human beings, except the name of the treated animal must also be listed on the prescription. The species of the treated animal must also be listed. In fact, I would go so far to say as make sure you get a weight if you can, especially on dogs, because dogs have this very vast range of weights. You can't just say dog on a prescription and that be sufficient. You can have a dog that's a Chihuahua and you can have a dog that's a Great Dane. A Chihuahua weighs 3 pounds, a Great Dane weighs about 200 pounds. So you have this very large range of possible doses with dogs. So get a weight on the animal as well. The name of the owner of the animal must also be listed on the prescription. And you'll have to bear with my allergies if you hear me sniffing. The ID of the animal when it comes to controlled substance databases. So depending on how your state's laws are written, in Michigan, the owner's information is sent to our controlled substance database, so it's owner's name and date of birth. There is no standard for name and date of birth of the animal, so checking the controlled substance database makes things a little entertaining, especially if your state mandates that you check one. So keep that in mind. Check with your state board of pharmacy. MAPS, by the way, is the Michigan Automated Prescription Service, and that's our state database. The ID of the owner goes into MAPS. And then there is a way to actually put animal on the database structure for MAPS. And when you do that in our map system, it actually puts a little dog next to those prescriptions. But each state is a little different as to how they do that. So check with your state board of pharmacy on how to handle veterinary prescriptions. If they don't have an answer for you, ask the board of veterinary medicine, because they typically will have the answer for you. As far as counseling patients go, DUR and counseling requirements have the same legal force as humans. So typically, in most states, This is the Michigan Public Health Code, but the practice of pharmacy doesn't change much from state to state. You must accurately interpret and evaluate the prescription, select the appropriate drug product, advise the prescriber and the patient as to the contents, therapeutic action, utilization, and possible adverse reactions or interactions of a medication. So if you're not familiar with that information, you might want to become familiar with that if you're dispensing veterinary medication. And then compounding, dispensing, and storing the drugs in a safe manner is also a requirement. Can you recommend a drug labeled for an animal for animal use without a veterinary order? The answer in general to that is no. You can counsel on animal drugs if and only if the drug is labeled and approved by the FDA for animal use. If it is an animal drug for human use, this applies. So patients asking about OTC animal therapies, pharmacists cannot counsel on an OTC therapy. That is an FDA prohibition. So federal law, I don't care what state you're in, federal law says any human drug safe for the use in animals is considered to be extra label use, and that requires a veterinarian prescription. So if a patient comes in and says, hey, I was told to get Benadryl for my dog, you can show them where the Benadryl is, and that's perfectly fine to do. If you feel comfortable telling them how to administer the Benadryl, feel free to give them that information. However, you cannot tell them what the dose is. That has to come from the veterinarian themselves. If they come in and say, hey, I need something for my dog for allergies, that's going to have to, unless you have some Benadryl that's labeled for dog use in your pharmacy. I'm not aware of any that is, but if there is, you can certainly do that. However, I don't know of a Benadryl labeled for animal use, so you would be stuck telling that patient to go back to the veterinarian. That's usually not a very popular answer, but federal law is very specific about that. If you compound, it must be dispensed on the receipt of a valid prescription. If you're compounding in advance of a prescription, you can have 14 days on hand based on the last 6 months of dispensing data. It cannot be used in food-producing animals. So you have to label your finished compound is not for use in food-producing animals. I have stories for days about food-producing animals and drugs. I will save that for a different episode of drug school because this is going on almost an hour and I don't want to bore you to tears. If an adverse event does occur, you do have to use a different FDA form. It is not the same form as human beings. It is what's called FDA Form 1932. I will put a link in the description for that as well. Compounded drugs cannot be provided to offices for the purposes of resale. That also is a federal law prohibition, so keep that in mind. If you do compound, the reason for compounding must be documented on the prescription, especially if you're using bulk powders. Bulk powders do have to have a USP or NF monograph on it. That is a federal law requirement as a result of the NECC incident. And you must purchase them from FDA-approved manufacturers. Some bulk powders are specifically only to be used on animals. Sildenafil, I believe, is still that way. Tadalafil, I believe, is still that way. So you may actually see some bulk APIs where it says only approved for use in animals. You do have to abide by those laws for the record. There is a dirty little secret I do have for you. Not all animal drugs have FDA approval, nor is FDA approval required in order to be sold for animals. In cases, these are required to have a prescription for those items. And you can look on DailyMed, if you're not familiar with the website DailyMed. You can look for FDA approval on DailyMed. And for the record, an NDC does not indicate FDA approval. This is what Daily Med looks like. And Daily Med, if you go all the way down to the bottom of the page under ingredients and appearances, it will tell you marketing information and that will tell you that it has been approved by the FDA and when. Can a doctor prescribe medications for an animal? The answer to that is no. That is outside their scope of practice. So I have had doctors try to prescribe animals for their dogs. We have to tell them no. They cannot do that. Here's the link for Form 1932A. It's on the FDA's website. Just search for it and you can get there. If you need the rules, you can get those from your board of pharmacy. You can also get those from the FDA. With that, 49 minutes into the episode in the rabbit hole of human drug compounding for animal use, and I'm going to leave it here. If you have any questions, feel free to leave them in the comments. If I can't answer them, I will go get an answer for you and get back with you. Or you can get in touch with me directly. My email address is in the channel description. I will be more than happy to answer your questions. Thank you for joining us for Drug School today. My name is Adam. Like and subscribe to the channel if you like what you see. If you'd like to help me out, you can donate to Drug School at any time, and I would appreciate those donations as it does help me produce these episodes. Pays for the software and pays for my conventions and pays for my education, so I can share this information with you. So thank you for joining us for Drug School today, and we'll talk to you again soon.